MDTi licenses and commercialises intellectual property from the NHS on Class 1 medical devices. In consultation with clinical practitioners, MDTi have developed a new product called the Hoo-kOn IV drip stand for easy and safe administration of intravenous drugs in patients' own domestic settings.
Good morning team, how are you all? We're alright.
Before going out to treat patients in their homes, the nurses will plan their day and gather the relevant patient records and care pathways of the patients they'll be visiting. They will also go through the fluids and equipment needed for their visits. The nurses will retrieve the relevant drugs from a secure locked cupboard, checked against the patient's specific direction to ensure the correct drugs are being used, following the management policy of the PCT. The drugs will be transported in a secure locked box to be placed in the boot of the car. It is essential for nurses to be appropriately prepared before commencing their visits, and the following checklist should be undertaken, including prescribed intravenous drugs and diluent, i.e. ampules of antibiotics, patient records, patient care pathways, letters of authority, sterile dressing towel, checking the date of expiry and that there's no rips or tears, sterile gloves, again checking date of expiry and that there's no rips or tears, starets, sharps box, giving set, checking that it's sterile, the date of expiry and that there's no rips or tears, electronic pump, turning it on to check the circuit breaker if necessary. The Baxter pump would usually be kept on fully charged. Fluid balance sheet, drip stand, flushing solution, variety of cannulas and venfons, checking that they're sterile and the date of expiry, needles for drawing drugs, checking that they're sterile, dressings for securing cannulas, tape and bandage for holding cannulas in place if required, syringes for drawing medication, checking that they're sterile and the date of expiry. The nurses will also take with them a nursing bag, the contents of which must be checked as follows: aprons, blood pressure machine, checking it by turning it off and on, hand gel, hand self-wash, thermometer, again testing by turning on, also checking that there are earpieces with it ready to use. The nurses will also take with them Clini wipes to clean the IV stand, which has been designed especially to easily clean in this way. Problems with previous drip stands have included their weight and size, causing problems with transportation and storage. But now, since the development of the new Hoo-kOn IV drip stand, nurses have something that's easily transportable, fitting with ease into smaller, greener cars with small car boots. This stand is also lightweight, adhering to moving and handling requirements. The Hoo-kOn IV drip stand is also easy to assemble, keep clean and store. It may seem common sense, but always establish the identity from the outset of the person letting you into their home. It will also allow you to establish if it is the correct person that you are there to treat. It is essential to ensure that the patient understands the procedure and gives their valid consent. Check the letter of authorization and the ID of the patient, the prescribed fluids, drugs and expiry dates to maintain safety and ensure the correct treatment is administered. Once you are sure that your patient understands the reason you are there and consented to you providing treatment, begin by assembling the Hoo-kOn IV drip stand, beginning with the base and feet, then the pole, securing it to your desired height, and then the cradle brackets and IV fluid hooks. Please see the instruction manual for further details. Once the stand is assembled, position the pump over the legs and plug it in. This is now ready to administer drugs according to the clinical practice for IV therapy. Under no circumstances attempt to hang the bag of fluid from the back of doors or use unapproved improvised devices such as coat hangers Any such setup is extremely dangerous and goes against recommended practice. When beginning the procedure to prepare drugs, first clean your hands and put on an apron and gloves to minimise the risk of infection. Make yourself a clean work surface using sterile towels to prepare the equipment. Check the bag of fluid for leakage or cloudiness. Observe for contaminated fluids. Check all drugs, fluids and patient details prior to administration to maintain the safety of the patient. Preparation and administration of the drugs should be carried out according to the clinical practice for IV therapy. The Hoo-kOn stand has been designed to be easily and safely stored away in the home when not in use. It can also be easily dismantled and reassembled if necessary in the home. Disassemble the drip stand, wiping down with a cleaning wipe. The telescopic hole can also be removed and cleaned separately if needed. On completion of the procedure, record the details in the patient's documentation to maintain accurate records and to comply with legal and professional requirements.